In this video, you're going to learn about who's being affected by the COVID-19 pandemic. We've all heard about how the elderly are most at risk of being affected by this virus. But recent disturbing data coming out of the CDC has shown that it's not just the elderly who need to worry. I'm going to walk through your why coming up. Welcome to Family Med. If you're new here, I'm Dr. Eric Richardson, a board-certified family practice physician. On our channel, we focus on trying to give you practical and accurate medical information to help you and your family make healthy decisions. If you think that this would be something that's helpful to you, make sure you subscribe, hit that notification button, and follow along with us. So as I said in the intro, we're going to go over why even if you don't consider yourself elderly, you still need to be concerned about this virus and take precautions to protect yourself. Still, the prevailing thought about this pandemic is that it only affects the elderly or those who have chronic medical conditions. These are the ones that are still most affected, but it's not the whole story. Our lack of information over the past couple months has led many to feel protected or complacent and not take those proper precautions. We saw evidence of this over the past couple weeks with young adults continuing to congregate at the beaches during spring break. And up until now, the recent shutdowns over much of the world, the bars and other social venues were packed. And we still see young adults socializing with groups of friends, even in smaller groups. Now, their excuses range from thinking that the virus won't affect them since they're healthy, to even if I do get infected, as long as I'm not around anybody who is old or sick, I don't have anything to worry about passing it on to them. Well, as time has gone on and more data has come out on this virus, we need to change the way that we've been thinking about this disease. It's not just a disease that affects the old and the sick. A lot of this idea has come from the data that we were getting coming out of China and Italy. There, it was seen the majority of those who were getting sick and dying from the disease were the elderly and those with underlying medical conditions. Now, this is certainly something that we're seeing as well. However, a recent compilation of data from the CDC showed a different story that we all need to take note and be concerned about. Data was recently released that looked at the cases in the United States in regards to who's getting really sick with this. The results were somewhat surprising and hopefully will change the way that you look at the disease. The time frame where this data was gathered was from February 12th through March 16th, 2020 from cases in the United States. At that point, there were a total of 4,226 reported cases. Of that, they were aware of the ages of about 2,449 of them. Of those patients, 6% of them were over 85, 25% were between 65 and 84, 18% were between 55 and 64, and 29% of the cases were between 20 and 44. And only 5% of the cases were under 20. Now, those were just the confirmed cases at the time, so certainly there were more that were affected. But in this analysis, I looked to see what happened to those who were confirmed to be infected. Here's where it should get your attention. Remember, these are people that were sick enough to be admitted to the hospital. Out of the confirmed cases during that time, there were 508 patients that were hospitalized. That was around 12% of those of the confirmed cases. Look at the graph here of those that have been hospitalized. Among the 508 of the patients that were known to be hospitalized, 9% were above the age of 85, 17% were between the age of 55 and 64, 18% were 45 to 54, and 29% were between the age of 20 to 44, and only 5% were in the age of 20. So a full 29% of the cases of people admitted to the hospital were in the age group where we are seeing many who feel that this will not affect them. Looking further, they saw that 121 patients were admitted to the ICU. Here we see that 7% of those were over the age of 85, 46 between 65 and 84, 36 were between the age of 45 and 64, and 12% were between the age of 20 and 44. Remember, these numbers are for those who are in the intensive care unit. These are the sickest of the sick, and 12% of them were in the age group where most think that they can't get sick. Now, we need to remember too, these numbers are from the date range ending in March 16th. At that point, there was only 4,226 cases in the whole United States. I'm filming this on the 2nd of April. The current confirmed count in the United States is over 200,000, with the world reaching over 1 million cases just today. By the time I finish editing this and you are watching it, it'll be even more. And that's just in 2 weeks. Ignore anything I've said in the past about this being comparable to flu. It isn't, and we have to stop treating it as such. Unfortunately, we haven't seen any great and easily accessible data on age breakdowns over the past 2 weeks, but the cases that we're seeing certainly are following this trend. And I understand that these numbers that I just shared from the CDC are prone to some error, mainly because this is such a rapidly changing story, and data coming in is changing all the time. But the overall point I'm trying to make, though, is true. This is not a disease that is just affecting the old. So those who are still feeling comfortable that they can go about their daily lives as if they're immune to this are going to be shocked when it infects you or somebody you love. As more and more information like this has come out, we need to take the right precautions to protect yourself and those around you. This virus can only affect you if you're exposed to it. If you take the social distancing orders that we're all supposed to be living under to heart, then we can stop this. It will take all of our efforts though, but working together we can do it. Now, as you've seen, this is a rapidly changing story. It's been a bit of a challenge trying to stay on top of this through videos. And it seems like every time I make a video about our current recommendations, those recommendations change. So make sure you keep yourself informed through reliable sources by checking out the CDC's website. I'll put a link in the description below. Now, we will try to keep you updated as best we can with our perspective here at Family Med. Now, so you don't miss out on any of it, make sure you subscribe and hit that notification button. Well, thanks for watching then, and we'll see you next time.